Hello, ladies and gentlemen. Welcome back to another Robert Morris University live tour. And for those of you joining us for the first time, welcome. For those of you guys logging back on to see us again, welcome back. Now, Robert Morris University live tours, let me just go ahead and explain that really quick. Now, our live tour series gives us a chance here at Robert Morris University to show you all around anything that we have to offer and show you all the little bits and pieces that make Robert Morris University unique. Now, myself, I am Andrew Dixon, and I am thrilled to be your host today for today's live tour. Now, we have been going segment by segment, showing you guys the different institutions here at Robert Morris University. So far, we've seen culinary, art and design, technology and media, and graphic design, liberal arts. Now, last but not least, we are here at the Institute of Nursing and Health Studies. This is the home of several of some of our strongest majors and programs here at Robert Morris University, and I am so excited to get to show you them today. They have a lot of different opportunities inside themselves, and the rooms, as you'll see, are pretty fun, except when the needles get involved. That's where I kind of go the other way. So I'm going to show you around. We're going to meet with some students, some faculty, and show you the different things that make nursing and health studies unique. And throughout the tour, you guys have an opportunity to chat in any questions you may have and speak with a Robert Morris University representative who will answer those questions during the live chat on the chat feature. Some of your questions might even make it on air towards the end of the tour. Pretty cool, huh? And at the end of the tour, I'll remind you again, you guys can take a survey that lets us know how we did, lets us know how much fun you had, lets us know how funny I am, not really, and it kind of gives us feedback going forward into our next set of segments. So without further ado, I would love to show you guys the College of Nursing and Health Studies. So it's all here. We are on our second floor of Robert Morris University. On the other side is actually art and design, where we were just a couple of weeks ago. And it's got a bunch of rooms which are all unique to the different majors that they offer. We offer several programs from the associate through the bachelor level, which gives our students a wide variety of different things to study with many different possibilities for careers. So some of these rooms are going to look pretty fun to you guys. We're going to head into one of my personal favorites, the Pharmacy Technology Lab. This is an associate level, our associate of applied science and pharmacy technology. This allows our students to learn the ins and outs of pharmacy technology, and they get to work two different externships, one in a commercial pharmacy and one in a hospital pharmacy. Now, everything you see here might look a little bit like Breaking Bad, but trust me, they're just sugar pills, all right? So our students get to work, measuring out liquids, filling the capsules with the medicine, and it's a really hands-on learning experience for them. And they can actually sit for their pharmacy technology certification exam while they're here at Robert Morris. And it's got a full setup just like you would find at any other commercial or hospital pharmacy, which is amazing. And you can actually go on. I'm going to talk a little bit about this later. You can go on from pharmacy technology into the Bachelor of Professional Studies. So as we're leaving the Pharmacy Technology Lab, we're going to head into another one of our rooms where our students will study. Another one of the programs that we have is our Medical Assisting Program and Exercise and Sports Studies. So it looks like we have some people hard at work here. Let's see if we can get them to interview them for a second. Hi guys, how's it going? All right, so I got some just quick little rules, which makes the microphone going a lot faster. They can only hear you when you talk about this close. So when I hand it over, and it's about this close to you guys, they'll be able to hear you. Sound good? Yeah. Cool. So I want you guys to go ahead and introduce yourselves, what year you are, and what you're studying in nursing and health studies. And you can go ahead and tell us your role when we get to you.
Okay. Hi, it's Javante Young. This is my first year, so I'm a freshman, and I am medical assisting.
All right.
My name is Aldina. This is my second year as a medical assistant, and I'm a sophomore.
I'm Dr. Michael Free, and I've been a professor at Robert Morris University for about 11 and a half years. And I teach medical assisting, some of the pharmacy tech classes, some anatomy, some of the bachelor's classes, so quite a variety of things.
All right, guys. Well, I'm so glad that you guys let me talk to you guys because I love speaking with students, especially when it's stuff that I think is really fascinating, but I don't know much about myself. So as a freshman, so this was your first quarter. What were some of the things that you found fascinating about medical assisting so far?
Just, like the drawing of the blood, learning, weird names and stuff, and knowing the meaning of it behind it.
All right. Now, as a sophomore, you're going to be finishing up your medical assisting program pretty soon. What do you think that you've learned the most through medical assisting? You want to take a look over there?
Communicating with the patients and learn how to draw more blood and blood. Yeah, pretty much doing needles.
Okay. Needles. Now everybody all I hear is drawing blood, drawing blood. By the way, the phlebotomy classes are always looking for volunteers. So if it could be fun. Not for me. And then
Make a good volunteer. I'm sure you have good veins.
that's what I hear. But I'm still not a big fan of needles. And then what would you say would be some of the coolest things that Robert Morris's like medical assisting or even pharmacy programs offer to students going into their professional fields?
Well, first of all, it's a very practically oriented type of courses that we have, and they learn how to do many different procedures, not just drawing blood, but giving injections, how to do vital signs, and help with surgeries, lots of other different procedures that they do in the medical assisting. In pharmacy tech, they learn how to fill prescriptions, they learn how to do calculations, and have externships in pharmacies, both hospital and retail, and medical assistants have externships in doctor's offices and learn how to do the procedures there in each doctor's office. So.
Have you done an externship so far?
No, it's this quarter.
All right. Well, good luck with that. I hear these myths about all these students going to cadaver labs. That's a little spooky for me, but what are some of the things they do over there?
Well, it's primarily the nursing students and the surgical tech students visit sometimes as well. And it's much easier to learn anatomy when you're seeing the actual parts than when you're doing it from a book and just looking at pictures. So.
Fair enough. Well, guys, thank you so much for taking the time to meet with me. It was great to learn some more about the medical assisting and pharmacy technology programs. We saw the lab. It looks amazing. All right, and carry on with whatever you're working. I'm sure was very important. Oh, cool. We've got one of my friends here. He's looks a little hung up, if you ask me. How's it going? I think we scared him to death. So we're going to go ahead and continue on our tour. We got a couple of other programs to show you. Namely, our surgical technology program is going to be our next stop, where we get the chance to check out the surgical technology lab. What's really interesting about surgical technology is that they assist with surgeries and prepping the operating room, and they handle not only the patient they're operating on, but many different instruments. And I'll tell you what, for an associate level in surgical technology, they can earn minimum, the median was $41,000 with an associate in surgical technology. But of course, that comes with a price as well. So let's take a look and see if we have. You can take a step peek in here, but I think they're going to the operating room. I think we might need to scrub up first. Give me just a second, guys. Got to see if I can do this right. All right. For the shoes. Close enough. It's a lot harder than it looks. Can't forget the hat. And this, I'm supposed to be wearing, but otherwise you won't be able to hear me. So I'm going to hang on to this for now. I think we're all set. Let's make our way inside. All right. I hope I'm properly outfitted to be in here. Hi, how's it going? So really quick, they won't be able to hear you unless this is right by your mouth, so I'll hand it over, and then you can be able to hear, okay? So if you want to first go ahead and introduce yourself, what year you are, and what you're studying here.
I'm Bridget Quinn. I'm technically in my junior year and studying nursing.
All right, studying nursing. Then would you like to join us over here? Sure. All right. We got someone in a white coat. That must mean business. So would you go and introduce yourself and then your role here at Robert Morris University?
Sure. I'm Dr. Mendes. I'm the program director for surgical technology. So we have our students here with us today to help us demonstrate what gowning and gloving is and getting ready for surgery.
Gowning and gloving, what is that?
on a
That
gown,
is his question.
Putting on a gown and putting on a pair of gloves before you touch the patient.
Okay.
So here what we're going to do. So first of all, you
Let me bring the microphone over here.
You scrubbed in, you clean and ready to go. You have a cap on, you have your mask on, right? Okay, so now we have a gown. So
You mind if I clip this microphone on you
sure,
here?
go ahead.
All right.
So now we have a gown. So remember, the inside is non-sterile, the outside is sterile. So you're going to stick your hand right through that, and there we go. So now you're going to keep your hands up because we're going to give you a pair of gloves. Now pretend, obviously, I'm in gown and gloves as already, right? So then we're going to give you a pair of gloves. First, the left hand. Just stick your hand right through it. There you go. Now with the second one, you're going to do this with that hand. There we go. No, the other way. Put your fingers up. Here, we're going to grab that. Put your hands in through. And there you go.
Like a glove.
Ready to go. Now you turn, because we're going to do the surgical dance. And I'll show how that is. That's right, that's right. All right, so turn around. You're going to take that tag and pull it out and hold the left piece. Well, it's supposed to do this. How about that? You pull that piece only one side and keep the other one. Half of this is sterile, the other half is not. So you're going to pull this out and hold this part, and you're going to hand me this part, because I'm going to touch the blue part only. And you're going to let go and spin around. There we go. Now you're going to pull that for me. Change hands. This goes there, and that goes there. And I'm going to pull it away. Now you can tie yourself. That's the surgical dance. Magic trick, that's right. So then, all the stuff here that I touch, everything's sterile, right? So you want to give me that, and throw that to me. Now, everything that's in there is sterile, right? So you're using your mask, of course. You use your hairband because you don't want your hair to fall into the patient's surgical wound and so forth. And then we're going to drape the patient, put all the drapery on the patient. We can start draping the Mayo stand. The Mayo stand is where the instruments that you're going to use right away are going to go into. And I'll show you how to do that. First of all, you take the stand, step on it with your left foot, and you can see it here. It says right hand and left hand. Right? So this is the cover. So you're going to grab it like this, because the top part is sterile, right? So you're going to do this way and push it all the way through without touching anything. So this is a sterile desk now. You're going to take a blue towel. Go ahead and take the blue towel.
I'm not sterile.
Yeah, so don't touch anything. All right, you're going to open that blue towel. There we go. And cover this plastic part, because no instruments should be touching the plastic stuff. There you go. Now make a nice little bed for your instruments, right? So you're getting ready there. Now, the next thing, we're going to make a roll to hold your instruments. And this is how we do a little roll here. And we roll this way. So you can make that log for me. Just roll it.
Now, how many instruments are you responsible for as a surge technician?
Thousands. No, just kidding. Well, each subspecialty have a set of instruments, right? So depending on the subspecialty, you will have the number of instruments. This one is just a general tray, which means it's used for general procedures, belly procedures like bowels and so forth. So here, this is how we do it. Grab it, and this is our roll to keep our instruments nicely and neat.
You can grab that microphone
Sure.
for me. Thank you.
And one other thing that we do here is what we call a sponge stick. Sponge stick is a stick that we use to make sure that we keep the blood out of the way, right? And we also have a cautery, which is this pen here that you can press and cauterize, meaning you can cut and cauterize the bleeding at the same time so the patient is not bleeding everywhere.
Well, that seems very, very effective. I have a ton of questions, but I mean, one of my first ones was just the amount of instruments. But I think one of the coolest things. Well, so you guys are surgical technicians, are right next to the surgeon. How long could they be at the operating table?
It depends, depending on the procedure. Procedures can last, from 30 minutes to 30 hours, right? We just had a double hand transplant at the University of Chicago and at Lourdes Hospital that some of our students participated on, and that took 36 hours. So it all depends.
So you remember when I was talking about, so the median salary for surge technicians? That's exactly it. Sometimes you don't get to sleep. Well, so what do you say some of like the risk rewards of like working in the surgery field?
Well, I think the motto of surgical technologists is patients first. So patient safety is the utmost concern that of the profession. They are the only professionals trained specifically to work in the operating room. So that's one of the major rewards of the profession, and you get paid really well.
All right. Well, it looks like with this amount of training that if ever I need some surgery, I'll be in good, sterile hands.
That is
Well,
correct.
thank you so much.
You're welcome.
There we go. So sterile fist bump. There we go. All right. Well, I'll let you guys carry on. Looks like a lot of fun stuff going on here, and we are going to head out. Thank you so much for talking with us today.
Yeah, have a good day.
Mhm.
Enjoy your day.
Check out. I don't know if you guys got to see this wall of machinery here. There's just so many instruments. I don't know. These guys have to keep all of them straight. They have to know what every single piece of equipment is too. So now, let me kind of get rid of this. I look kind of silly. So our nursing, our medical assisting, pharmacy technology, medical assisting, and surgical technology programs are all associate level, and then you can carry on into a Bachelor of Professional Studies. And this has two different points. One is the fitness track, and the other one is the health track. Now, this can land you in a lot of fields, from anywhere to health manager to a fitness trainer, things like that. So that's definitely an option a lot of our associate level students take. Now, we are making our last stop here, the creme de la creme of nursing and health studies. We have our Bachelor of Science in Nursing, and we are in the Nursing Sim Lab now. We have a bunch of students working on something. I wish I knew exactly what it is. Maybe we can find out some more information. Hi, guys. How's it going?
Hi, great.
So I'm going to have you guys first introduce yourselves and then say your name, what year you are, what you're studying, and then from you, if I can get your name, and then roll here. All right?
Hi, I'm Jessica. I'm a sophomore studying nursing.
I'm Kian. I'm a sophomore nursing student as well.
Got some competition here. And then over here we have.
My name's Reagan Quant. I'm a nursing faculty full-time. I'm also the curriculum chair for the nursing program.
Well, congratulations.
Thank you.
So who wants to go ahead and kind of give me a breakdown of what we're working on here?
Well, what we got here, let's see. Well, these things are kind of technologically advanced, so we're just getting used to them. But this way we can simulate that the body has like vital signs, so we can practice our taking normal nursing skills with this body as it's a real person rather than just a plastic being. So
it has a heartbeat, it can have respirations, it can do a lot of the things that we'd be able to assess as nursing students.
we've even practiced suctioning and other skills that are pretty complicated, and it helps having this technology like this. So.
That's awesome. And we have this ability to kind of like simulate the real world scenarios. That way we're getting the most accurate training possible. What are some, what would you say some things that we really focus on here with like using the dummies for? Like what sort of like nursing procedures do we practice?
Well, for instance, next quarter, both of these students have maternal child. So we just got a new sim mom over here, and we can walk down there if you want to see her. But she actually delivers babies, and that's really big because this is new for them, and it's a short, segment of them for maternal child. But it's really awesome that they get to visit and experience that in the lab as well. And then we also have the babies that we hook up to monitors, and then it'll show up here on the screen here, and we can program them, and they can work, application style on case studies and things like that. So yeah.
I would say that the abilities that we have now are super advanced. Let's kind of check a look at now. Let's go down the rest of the nursing wing down here, and see. We got a lot of simulators.
Yeah.
You guys call them simulators, right? Not dummies.
Yeah.
All right. I'm just trying to be at nursing correct.
This is our newest, and we call her our sim mom, but she is obviously pregnant. And so we can, they can check fetal tones, fetal heart tones for her, and they can take care of the patient, through her pregnancy, and then, after the patient has her child. So, and then we even have the babies, which are right behind you, over where Jessica's standing. And then we have the monitors hooked up to the baby as well. Of course, none of this is turned on currently, but this would be what we're doing next quarter.
All right, so you guys are all going to be a bunch of, so he's the OB training. That's awesome. Okay, so guys, what would you say? What would say one of the best things that you've learned here through our programs at Robert Morris?
I feel like it's really nice to have a lab where we can kind of practice what we are learning in class before going out into clinicals. That way, we're not surprised at what, with what to expect. And then I feel like all of the teachers that we have are very, always very helpful with anything that we really need with help to get.
Yeah, I think it was great to be able to come in here in the lab and do stuff like giving shots before actually having to go on a real person and actually giving real medication. So having that ability to practice before you put it into real life is very helpful and something that I appreciate about Robert Morris.
All this talk about shots is just making me queasy. And then I guess from faculty, what would you say is probably one of the most unique things that our Robert Morris Nursing and Health Studies has to offer?
I would say that they have smaller class sizes than what a normal nursing program would have, and I think that is huge, especially in labs. We don't have 20 students in here working in a lab. We have, it'd be the size of their clinical group, so about 8 to 10 students. And then they get to work with the lab instructor, and then we really have more one-on-one time here, and I think that's important.
All right, well, guys, thank you so much for meeting with me. And Sims, thank you guys, too. You guys were great.
Thank you.
There you go. Thank you guys so much. Well, good luck with everything. Good luck with the baby next quarter. And then Sim Mama, you guys have a great rest of your day. Thank you. So the nursing sim lab seems to be a lot of fun. There's a lot of stuff going on, too. Oh, man, every time they talk about needles, though, making me squirm. So that's all of our programs here. So you've heard about surgical technology, medical assisting, pharmacy technology, and surgical technology. And all of those, again, build into a Bachelor of Professional Studies, which, just like culinary and graphic design, also add in that a little business half as well. So you get that Associate of Applied Science, which builds into the Bachelor of Professional Studies. So that business aspect a lot of people like. And then we have our Bachelor of Science in Nursing, which is actually really cool because a lot of magnet-certified hospitals are actually requiring that bachelor level now, which is why we decided to go ahead and offer it. And then our students also do clinicals outside in schools like in hospitals like Mount Sinai, Northwestern, Norwegian American, and and the Highland Park, things like that. And they just get so much real-world experience on top of all the simulators that we have as well. And that kind of brings our tour to a close. We saw all of the rooms that really make this part of our school unique, and we met a lot of great students and faculty that are really excited and knowledgeable about nursing and health studies. So now I was just wondering if you had any questions that made its way onto the air that I can answer for you guys. Yep. So our nursing program has one of our steepest admission requirements, but it's very achievable. Is we need a 21 composite in math and science on your ACT and a 2.5 GPA. So, and yep, that's a great question. All right, the clinicals, again, you'll go out and work in hospitals, especially in the Illinois Medical District. Like, our surgical technicians will work at Rush, like in the hospitals I mentioned before. Yep, you can come on your own personal visit. You go to robertmorris.edu/visit, and you get to join us on campus in person, not on the other side of the camera. And you might even get to meet with me or another one of our admissions counselors to get a tour of the school yourself and answer any questions you may have about your program. All right? So this wraps things up, and stay tuned. We will be doing some more live tours, and you'll get to hear about that soon enough. And at the end of the tour, I will go ahead and invite you guys again to take that survey. And it's going to pop up at the end. Just let us know how we're doing. Give us some feedback. And I just want to say, hey, this is Andrew again. Thank you so much for joining me on this virtual tour. And I will see you again real soon. So signing off, guys. Have a great one.